Caring for our portfolio of Shiley flexible tracheostomy products requires some simple but important steps. Let's review cleaning and care information for the Shiley flexible tracheostomy tubes with disposable and reusable inner cannulas. Each Shiley adult flexible tracheostomy box with disposable inner cannulas include a tracheostomy tube, a disposable inner cannula, a blue obturator, and a tracheostomy tube twill tie. The obturator is used during the initial placement of the tracheostomy tube. It helps ensure the cannula remains rigid as it's being inserted. The twill tie secures the tube at the patient's neck. Alternatively, a tracheostomy tube holder can be used to secure the tracheostomy tube. The disposable product line features an inner cannula that is removed and replaced with the new inner cannula twice daily or based on your patient's needs. The inner cannulas used in the disposable line are not approved for reprocessing and have not been tested for long-term use. They are identified by a "Do Not Clean" label etched on the body of the inner cannula. To replace your disposable inner cannula, start by washing your hands, then with a gloved hand, hold the neck flange steady with one hand. With the other hand, gently pull the inner cannula out of the tube using a downward motion. Throw away the used inner cannula. Gently insert the new disposable inner cannula into the tube. Ensure that it is securely in place. Additional disposable inner cannulas can be purchased separately in boxes of 10. For use instructions specific to your tracheostomy tube's disposable inner cannula and for guidance on how often to change it, please refer to the instructions for use. Each Shiley flexible adult tracheostomy tube box with reusable inner cannulas include a tracheostomy tube with 2 reusable inner cannulas. The package also includes a blue obturator, which is used during initial placement of the tracheostomy tube. The obturator helps ensure the cannula remains rigid as it is being inserted. The reusable inner cannula should be cleaned once daily or based on the patient's needs. 2 inner cannulas are provided so that one is always clean and ready for use should the other become occluded or be in the process of cleaning. Every box containing a Shiley flexible tracheostomy tube also includes twill ties to secure the tube at the patient's neck. Alternatively, a trach tube holder can be used to secure the tracheostomy tube. The Shiley flexible reusable product line offers 2 reusable inner cannulas. The inner cannulas are cleaned daily or based on the patient's needs. It's reused for up to 29 days. It is important to note that there are no replacements or supplemental inner cannulas for the reusable tracheostomy line. If the reusable inner cannulas are lost, damaged, or thrown away before that 29-day period, a replacement inner cannula can be used from a new and identical tracheostomy tube box, or the entire tracheostomy tube must be replaced. To clean your reusable inner cannula, you'll need supplies including sterile gloves, neutral detergent such as a mild dish soap, sterile water, a container or a cleaning basin, a soft brush, cotton swabs, sterile lint-free gauze, and sterile pre-cut lint-free gauze, or a prescribed dressing for under the flange. If applicable, you may also need a spare reusable cannula, suction, and ventilation equipment. Make sure to follow policy procedure and provider recommendations when caring for a patient's tracheostomy. It's important to note that an extra tracheostomy tube that's one size smaller should always be available at the bedside in the event of an accidental decannulation. After gathering your supplies, wash your hands and prepare the patient to suction and pre-oxygenate in accordance with your facility policy and the provider orders. Remove the soiled inner cannula by pinching and pulling it in a downward motion. Replace it with a spare inner cannula if applicable. Shiley flexible tracheostomy tubes do not require an inner cannula to connect ventilation equipment. However, use with an inner cannula is preferred. Check with your provider for guidance. Place the soiled inner cannula in a prepared solution of neutral detergent and sterile water. Let it soak for at least 30 seconds. Use a soft brush or the sterile gauze until the visible secretions are removed. Remember, do not use cleaning agents such as hydrogen peroxide, alcohol, or bleach. They can cause damage to the inner cannula. Next, rinse the reusable inner cannula with sterile water and air dry with a gentle shake. If any sign of wear is present, dispose of the inner cannula and replace it with a new reusable inner cannula. Reusable inner cannulas should not be used beyond 29 days. Remove the spare inner cannula and reinsert the cleaned inner cannula. Press it lightly into that lock position. Reconnect any ventilation equipment if applicable. For use instructions specific to your tracheostomy tube's reusable inner cannula, please refer to the instructions for use. Stoma care is a really important part of tracheostomy care. It should be done at least twice a day, once in the morning and once at night. The supplies you will need for skin care include cotton swabs, facility or provider prescribed skincare solution. This can be either soap and water, hydrogen peroxide and sterile water, or other prescribed skincare solution. You'll also need pre-cut tracheostomy dressing and a sterile gauze pad. To clean the stoma site, first wash your hands and put on gloves. Then dip a cotton swab into the skincare solution. Roll the cotton swab between the tracheostomy flange and the skin and the stoma, cleaning from the stoma outward to remove wet or dried mucus. Repeat these steps using a fresh cotton swab each time until the entire area around the opening is clean. Rinse the area using clean cotton swabs dipped in sterile water only. Then use a dry gauze pad to pat lightly around the opening to dry. Replace the tracheostomy dressing if applicable. Remember to follow your facility's policy and provider's orders when caring for the skin and the stoma of your patient. For complete guidance on cleaning and care, please refer to the product instructions for use, AACN guidelines, facility guidelines, and provider recommendations. Shiley flexible tracheostomy tubes may not be reprocessed and are not intended for multi-patient use. Shiley tracheostomy tubes may be used for up to 29 days.